Hello everyone, I hope you all are doing good. So topic for today that I have chosen is to talk about skull in human anatomy. It's a very important topic as not in a theoretical point of view, but in practical, they will ask you about skull in your first year of BDS, right, in anatomy exam. So what is skull basically? Skull is skeleton of head. It's a very simple definition. Skeleton of head is called as a skull. It also includes mandible or lower jaw. This is a separate bone, but it is also considered as a part of a skull. So, skull basically has two parts, calvaria, or it is called as a brain box, and the second part is facial skeleton. So, calvaria or brain box is nothing but upper part of the cranium. And facial skeleton consists of mandible. Now coming to the bones of skull, total 48 bones are present, out of which calvaria or brain box consists of 14 bones and facial skeleton consists of 14 bones. Right? Both have 14 bones. Out of these 14 bones, 3 are paired ossicles of ear, that is Nihilus incus stabilis, and 11 bones, 3 are paired. Then parietal, temporal, these are also paired. So these bones are paired. Unpaired bones are frontal, occipital, sphenoidal, and ethmoidal. You can remember these 4 as fossae. This is basically a mnemonic that I have used while I was studying. So here in 14 bones, unpaired and paired. Unpaired bones are mandible and vomer. These two are unpaired bones. Very simple, just 2 bones you have to remember. Whereas paired bones are, iska mnemonic for this that I have used is maze na le palat idhar. This was the mnemonic that I have learned. So what is this? Maxilla, zygomatic, nasal, lacrimal, and palatine. These all are paired bones, right? So one more important point that you have to remember is that base of skull ossifies in cartilage. इसका cartilaginous ossification होता है, whereas skull cap और calvaria इसका membranous ossification रहता है. So this is an important point. They can ask you in your Viva question, right? Tell us about that. Then there are a few points that you need to remember when it comes to skull. So what are emissary veins? They can ask you what are emissary veins. Emissary veins are nothing, but these are the small veins that connect intracranial venous sinuses to extracranial veins. So why are they important? Right? These emissary veins, they basically connect these two things. They are important because they help in relieving intracranial pressure. So these are valveless, because of which infection to cranial venous sinus can occur because they are valveless. And one more question they can ask you about, which is the densest bone of body? I remember this question, they had asked me about this. Densest bone of body is petrous temporal bone. Why? Because it lodges internal ear and middle ear. That is malleus, incus, and stapes. And one more question can be asked, what are pneumatic bones? Pneumatic bones are bones that are hollow and have air cells in them. So basically, why are they so important? Because they reduce, again, because they are hollow, so they reduce the weight of a skull. Secondly, they maintain humidity of inspired air, the air that we breathe in. And give resonance to voice. Plus, if infection occurs in this, then it leads to sinusitis. Many of you must have been aware of this word, right? So what are the examples? Remember two main examples, which is frontal bone and maxilla. These two are fine example of pneumatic bones. So that's it for today. Just let me know if you have any other topic that you want to learn about. I will try to help you out in that. In Viva point of view, I think if they ask you about a skull, this is basically just an overview for that. A lot more is still in here, which I will upload in my next segment. So till then, tata, bye bye, take care, and let me know in the comments if you find it interesting or not, or if there any chance, if you want any changes, then you